Hello folks, this is Shiraz. Welcome to our channel runningcompany.in. It's all about running. Today's topic of discussion is IT band syndrome, iliotibial band syndrome. It is also known as ITBS, that is iliotibial band syndrome. It is also known as ITBFS, that is iliotibial band friction syndrome. So IT band syndrome or ITBS syndrome is nothing but an overuse injury which will cause a knee pain, inflammation and tenderness, majorly around the knee or the outer side of the knee joint. So now let us get into the understanding of the anatomical structure of the IT band. IT band starts from the iliac crest of the pelvis. Then it runs down from the lateral part of the thighs, crosses the knee to meet a top of the tibia, that is the shin bone. It forms out of TFL, that is tensor fascia lata, and from glute minimus and medius in the buttock. IT band is one of the hip abductors, that is it helps in moving the hip away from the midline. It is one of the most important stabilizer as it helps in flexion and extension of the knee. So now let us understand the symptoms of ITB. One of the major symptoms is the pain surrounding the knee area, lateral side of the knee area. You will feel extreme pain as the heel strikes the ground, or while you are trying to climb up the stairs or down the stairs, you will feel major pain, and it could be debilitating and increasing as you try to continue the activity. Some may feel snapping and popping around the knee area. There could be minor swelling just below the knee area where the band meets the tibia or where the band attaches the tibia. So now that we understand the symptoms, let us understand the cause of ITBS. Yes, it is overuse injury, and the one of the key factor is the wrong mechanics, that is the wrong running form, or if you are a heel striker, it should be a cause of concern. It is also very common among cyclists. Cyclists majorly while they are pedaling, and if they turn their toes inward, that can put tremendous load on the IT band and it can lead to ITBS. Yes, as with the other exercise, people who do excessive squatting, all the movement that causes knee extension and knee flexion and the repetition can cause ITBS. The another cause for ITBS is the discrepancy in the length of the leg, and the most important of all, muscular imbalance, that is you may develop a knee pain, but the cause could be either the weak glute muscle, that is glute medius, glute minimus, or even the quadricep and the hamstring. So we will need to not only work on those areas but work and know the imbalances. Running too many uphills can also cause the ITBS. I have also noticed that whenever I run on the beach where the water meets the sand, that area is usually irregular and downwards. So that causes a pelvic tilt. So it's important that you always run one way and come back the other way so that it can balance it out. Otherwise, it can become a major cause for concern and also the injury. So now let us understand the most important part of the treatment of ITBS, that is RICE, rest, ice, compression and elevate. These are the most important factor when it comes to the treatment, and it always becomes a start line of treatment. So as there is inflammation and if the pain increases with the activity, it is very important that one must step back and rest for few days. It's very important. Ice compression should start immediately within 2 to 3 hours of the inflammation or the pain. You should be doing ice compression at least 10 to 15 minutes to about 20 minutes, at least 3 to 4 times a day. And whenever you get the chance during the day, do not forget to elevate the leg. That helps you in recovery. This may be the right time for a physiotherapist intervention. After a physical examination or the physiotherapist assessment, it is very important that we understand the underlying cause. It could be the footwear, or you may also need a orthotic sole It's very important at this point to get your gait analyzed, and even after 2 to 3 days of rest, ice compression and elevation, the pain doesn't subside. This is a good time. You may look into visiting your physician and take some anti-inflammatory drugs that may help you to relieve you from the pain. But you may want to visit a physiotherapist again where you may need an ultrasound treatment. And last but not the least, it's very important when the pain subsides, you must be doing your foam rolling, get back to doing your foam rolling, and the most important part is lengthening and strengthening. These are the exercises that you should involve in your daily routine that will help you to recover faster. Hope you've liked the video. Do give us a thumbs up and do watch my next episode where I demonstrate my top 5 exercises which will not only help you to recover faster but also prevent recurrence of ITBS. Do stay tuned. Until then, this is Shiraz signing off from runningcompany.in. It's all about running.